I'm Dr. Richard Hoefer from the University of Texas at Arlington's School of Social Work. With strong support from the Hogg Foundation for Mental Health, I'm presenting information to help you learn more about the Recovery to Practice movement and what the principles of recovery are. The purpose of this training is to advance the goal of the Hogg Foundation Recovery to Practice grant program. We seek to enhance the implementation of recovery-oriented practice among behavioral health practitioners through participation in comprehensive discipline-specific training, including for social workers. Let's review the definition of recovery with some added detail. Recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Recovery is a broad term focusing on the whole person, not just a disorder, condition, or their related behaviors. It has a foundation in hope, the belief that these challenges and conditions can be overcome. Recovery is holistic, addressing the whole person and their community, and is supported by peers, friends, and family members. The process of recovery is highly personal and occurs via many pathways. It may include clinical treatment, medications, faith-based approaches, peer support, family support, self-care, and other approaches. Recovery is characterized by continual growth and improvement in one's health and wellness that may involve setbacks. And due to setbacks being a natural part of life, resiliency is a key component of recovery that gives individuals the capacity to cope with life's challenges as well as be better prepared for future stressors. To better understand recovery, the Substance Abuse and Mental Health Services Administration, known as SAMHSA, created 10 principles of recovery. We're going to look at each one individually. Recovery emerges from hope. The belief that recovery is real provides the essential and motivating message of a better future, that people can and do overcome the internal and external challenges, barriers, and obstacles that confront them. Hope is internalized and can be fostered by peers, families, providers, allies, and others. Hope is the catalyst of the recovery process. Recovery is person-driven. Self-determination and self-direction are the foundations for recovery as individuals define their own life goals and design their unique paths toward those goals. Individuals optimize their autonomy and independence to the greatest extent possible by leading, controlling, and exercising choice over the services and supports that assist their recovery and resilience. In doing so, they are empowered and provided the resources to make informed decisions, initiate recovery, build on their strengths, and gain or regain control over their lives. Recovery occurs via many pathways. Individuals are unique with distinct needs, strengths, preferences, goals, culture, and backgrounds, including trauma experiences, which affect and determine their pathways to recovery. Recovery is built on the multiple capacities, strengths, talents, coping abilities, resources, and inherent value of each individual. Recovery pathways are highly personalized. They may include professional clinical treatment, use of medications, support from families and in schools, faith-based approaches, peer support, and other approaches. Recovery is nonlinear, characterized by continual growth and improved functioning that may involve setbacks. Because setbacks are a natural, though not inevitable, part of the recovery process, it is essential to foster resilience for all individuals and families. Abstinence is the safest approach for those with substance use disorders. Use of tobacco and non-prescribed or illicit drugs is not safe for anyone. In some cases, recovery pathways can be enabled by creating a supportive environment. This is especially true for children who may not have legal or developmental capacity to set their own course. Recovery is holistic. Recovery encompasses an individual's whole life, including mind, body, spirit, and community. This includes addressing self-care practices, family, housing, employment, transportation, education, clinical treatment for mental disorders and substance use disorders, services and supports, primary health care, dental care, complementary and alternative services, faith, spirituality, creativity, social networks, and community participation. The array of services and supports available should be integrated and coordinated. Recovery is supported by peers and allies. Mutual support and mutual aid groups, including the sharing of experiential knowledge and skills, as well as social learning, play an invaluable role in recovery. Peers encourage and engage other peers and provide each other with a vital sense of belonging, supportive relationships, valued roles, and community. Through helping others and giving back to the community, one helps oneself. Peer-operated supports and services provide important resources to assist people along their journeys of recovery and wellness. Professionals can also play an important role in the recovery process by providing clinical treatment and other services that support individuals in their chosen recovery paths. While peers and allies play an important role for many in recovery, their role for children and youth may be slightly different. Peer supports for families are very important for children with behavioral health problems and can also play a supportive role for youth in recovery. Recovery is supported through relationship and social networks. An important factor in the recovery process is the presence and involvement of people who believe in the person's ability to recover, who offer hope, support, and encouragement, and who also suggest strategies and resources for change. Family members, peers, providers, faith groups, community members, and other allies form vital support networks. Through these relationships, people leave unhealthy and/or unfulfilling life roles behind and engage in new roles, such as partner, caregiver, friend, student, or employee. These lead to a greater sense of belonging, personhood, empowerment, autonomy, social inclusion, and community participation. Recovery is culturally based and influenced. Culture and cultural background in all of its diverse representations, including values, traditions, and beliefs, are keys in determining a person's journey and unique pathway to recovery. Services should be culturally grounded, attuned, sensitive, congruent, and competent, as well as personalized to meet each individual's unique needs. Recovery is supported by addressing trauma. The experience of trauma, such as physical or sexual abuse, domestic violence, war, disasters, and others, is often a precursor to or associated with alcohol and drug use, mental health problems, and related issues. Services and supports should be trauma-informed to foster physical and emotional safety and trust, as well as promote choice, empowerment, and collaboration. Recovery involves individual, family, and community strengths and responsibility. Individuals, families, and communities have strengths and resources that serve as a foundation for recovery. In addition, individuals have a personal responsibility for their own self-care and journeys of recovery. Individuals should be supported in speaking for themselves. Families and significant others have responsibilities to support their loved ones, especially for children and youth in recovery. Communities have responsibilities to provide opportunities and resources to address discrimination and to foster social inclusion and recovery. Individuals in recovery also have a social responsibility and should have the ability to join with peers to speak collectively about their strengths, needs, wants, desires, and aspirations. Recovery is based on respect. Community, systems, and societal acceptance and appreciation for people affected by mental health and substance use problems, including protecting their rights and eliminating discrimination, are crucial in achieving recovery. There is a need to acknowledge that taking steps towards recovery may require great courage. Self-acceptance, developing a positive and meaningful sense of identity, and regaining belief in oneself are particularly important. The Guiding Principles of Recovery by SAMHSA provide further insight into recovery and how it can assist service providers in the treatment of mental health and substance abuse. In the next video, you'll learn how the concept of recovery was created and how services within the community can incorporate recovery to help treat mental health and substance abuse.